Hello everyone, I'm here, and today we are going to talk about diabetes mellitus, sometimes called simply diabetes. We will look at what it is, the major causes, risk factors, symptoms, as well as complications that can arise if it's left untreated. At the end, we'll see how we can manage and prevent diabetes. So let's get started. Number 1. What is diabetes mellitus? Diabetes mellitus is a chronic condition in which the body cannot properly process blood glucose, also called sugar. Glucose is the primary source of energy for the cells in our body. However, for glucose to be used by these cells, it needs to be transported into them via the bloodstream. This is where insulin, a hormone produced by the pancreas, plays a major role. In diabetes, the body either does not produce enough insulin or cannot effectively use the insulin it produces, leading to a buildup of glucose in the bloodstream rather than inside the cells. This results in a condition called hyperglycemia, which is a key characteristic of diabetes. There are three main types of diabetes. The first one is type 1 diabetes. It is an autoimmune disease in which the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. This type is usually diagnosed in childhood or adolescence, but it can also develop in adults. Type 1 diabetes is not preventable and requires lifelong insulin therapy to manage. The second type is type 2 diabetes. It is the most common type, accounting for about 90% of all diabetes cases. Type 2 diabetes is often related to lifestyle factors such as obesity and physical inactivity, as well as poor diet and high sugar intake. Unlike type 1 diabetes, it can sometimes be prevented or delayed with lifestyle changes. The third type is gestational diabetes, which develops during pregnancy. It typically affects pregnant women who have never had diabetes before. Gestational diabetes usually resolves after the baby is born, but it increases the risk of developing type 2 diabetes later in life for both the mother and the baby. 2. Major causes and risk factors. Diabetes can have multiple causes, and it's essential to understand the underlying mechanisms to effectively manage the condition. One significant factor is genetics and family history. If you have a close relative with diabetes, your risk of developing the disease increases. This is particularly true for type 1 and type 2 diabetes. Another major cause is obesity and physical inactivity. As mentioned earlier, type 2 diabetes is closely linked to lifestyle factors such as being overweight and not getting enough exercise. Excess body fat, especially around the abdomen, can interfere with the body's insulin signaling pathways, leading to insulin resistance and elevated blood sugar levels. Poor diet and high sugar intake, particularly of processed foods and sugary drinks, contribute significantly to the development of type 2 diabetes. Consuming excessive amounts of glucose overwhelms the body's insulin processing capacity, leading to hyperglycemia. Insulin resistance is a key mechanism in type 2 diabetes where the body's cells become less responsive to insulin, hindering glucose uptake and utilization. This forces the pancreas to produce more insulin, which over time may lead to its dysfunction. 3. Common symptoms. Several common symptoms are associated with diabetes, and being aware of them is crucial for early diagnosis and management. Frequent urination, especially those unexpected trips to the bathroom at night, is a hallmark symptom of diabetes. This happens because high blood sugar levels cause the kidneys to work overtime to filter and absorb the excess glucose, leading to increased urine production. Excessive thirst and hunger are other common symptoms. High blood sugar levels can trigger excessive thirst due to the osmotic diuresis caused by increased urine production. This in turn leads to dehydration and a feeling of constant thirst. Increased hunger, even when you've just eaten, is another symptom of diabetes. This is because your body isn't able to properly utilize the glucose in your bloodstream for energy, leading to a feeling of emptiness and a craving for more food. Fatigue and tiredness are common in people with diabetes, especially those who are not managing their blood sugar levels effectively. High blood sugar can cause the body to become more tired and fatigued since the body's cells aren't getting enough glucose for energy. Slow wound healing is another symptom. High blood sugar levels impair the body's natural healing process, making it harder for wounds and cuts to heal properly. This can lead to chronic wounds that are slow to heal and prone to infection. Unexplained weight loss is a symptom of diabetes, particularly type 1. When the body cannot properly process glucose for energy, It may start breaking down muscle and fat for fuel, leading to unintended weight loss. 4. Complications if left untreated. Diabetes can lead to various complications if left undiagnosed or poorly managed. One of the most serious risks is heart disease. High blood sugar levels can damage the inner lining of blood vessels, leading to atherosclerosis, a condition in which the arteries become narrowed and hardened. This increases the risk of heart attack and stroke. Another complication is kidney damage. The kidneys play a vital role in filtering waste and excess glucose from the blood. However, when blood sugar levels are too high for a prolonged period, it can overwhelm the kidney's filtering capacity, leading to diabetic nephropathy, a condition in which the kidneys are unable to effectively remove waste from the blood. This can progress to kidney failure if left untreated. Vision loss, also known as diabetic retinopathy, is a complication that affects the eyes. High blood sugar levels can damage the blood vessels in the retina, the part of the eye responsible for capturing images and sending them to the brain. This can lead to blurred vision, blind spots, and in severe cases, blindness. Nerve damage, also called neuropathy, is another potential complication. Diabetes can cause high blood sugar levels to damage the nerves, particularly those in the extremities like the feet and hands. This can lead to numbness, tingling, burning sensations, and in severe cases, loss of sensation, which can increase the risk of injuries and ulcers. Amputations. When nerve damage or poor blood circulation caused by diabetes leads to non-healing wounds or ulcers, it can result in gangrene. This is a condition in which there is tissue death due to a loss of blood supply. Gangrene can affect the toes, feet, fingers, or any other part of the body. And if it's not treated promptly, it may necessitate amputation as a last resort. 5. How to manage and prevent diabetes. Managing and preventing diabetes involves a multifaceted approach that includes lifestyle modifications and, in some cases, medical intervention. Healthy eating is fundamental. A balanced diet that is low in sugar and carbohydrates and high in fiber can help regulate blood sugar levels. Choosing complex carbohydrates over simple sugars and consuming lean proteins and healthy fats can aid in better blood sugar control. Regular exercise is crucial. Physical activity helps improve insulin sensitivity, allowing your body to utilize glucose more effectively. Aim for at least 150 minutes of moderate-intensity aerobic exercise or 75 minutes of vigorous intensity exercise per week. Weight control, particularly for those who are overweight or obese, can significantly impact diabetes management. Losing even a small amount of weight can help improve insulin sensitivity and reduce the risk of diabetes complications. Monitoring blood glucose levels is essential for those with diabetes. Regular monitoring helps individuals understand how their diet, exercise, and stress levels affect their blood sugar, enabling them to make informed lifestyle adjustments. Taking medication or insulin as prescribed by a healthcare professional is critical, especially for those with type 1 diabetes or type 2 diabetes who are not able to manage their blood sugar levels effectively through lifestyle changes alone. Adhering to the prescribed medication regimen can help maintain proper blood sugar levels and prevent complications. In conclusion, diabetes mellitus is a chronic condition that affects the body's ability to process blood sugar. Understanding the causes, symptoms, and potential complications of diabetes is crucial for early diagnosis and effective management. By adopting a healthy lifestyle, including a balanced diet, regular exercise, and weight control, as well as monitoring blood sugar levels, and taking medication as prescribed, individuals with diabetes can effectively manage their condition and reduce the risk of complications. If you found this helpful, like and share. More health tips coming soon.